A patient comes to OPD with the complaints of nausea and vomiting. He was on cisplatin-based chemotherapy for 3 days. Now remember, cisplatin is an anti-cancer drug. And cisplatin among all anti-cancer drug causes maximum risk of vomiting. So we call this condition as chemotherapy because chemotherapy is anti-cancer drug induced nausea and vomiting. Fine. So in chemotherapy induced nausea and vomiting, if this vomiting is still 1 day old, less than 24 hours, we give 5-HT3 antagonist. These drugs, they end with the word cetron. But if it is beyond 1 day or 24 hours, then we add other drugs. Then we also add NK1 antagonist, neurokinin 1 receptor antagonist. They will end with the word pitant. We also add corticosteroid like dexamethasone. And in still resistant cases, we add cannabinoid CB1 agonist like dronabinol, nabilone. This is how we treat chemotherapy-induced nausea and vomiting. So overall drug of choice is cetron. So now here the patient is having 3 days nausea and vomiting. It is more than 1 day. So don't you think we have to give all drugs? So we give 5-HT3 antagonist cetron, NK1 antagonist pitant, and corticosteroid like dexamethasone. So D is the correct answer. So let's see what are the drugs for chemotherapy induced nausea and vomiting. So till 24 hours or 1 day, which is known as early phase of nausea and vomiting, the drug of choice is cetron. That is ondansetron, granisetron and palbocetron. If it is beyond 24 hours, after 1 day, this is known as delayed phase of chemotherapy induced nausea and vomiting. Here we add pitants. Pitants, they block NK1 receptor, neurokinin 1 receptor, and they end with the word pitant. Aprepitant, fosaprepitant, rolapitant, netipitant. Then we also add corticosteroid dexamethasone and CB1. CB1 is a receptor of cannabinoid receptor agonist. They will have NABI word in them, like dronabinol, nabilone. And these drugs also stimulate appetite, which is a good thing in cancer patient because cancer patient, they suffer from severe weight loss. So CB1 has one additional effect also.